Good afternoon, ladies and gentlemen. Welcome to Bruker Molecular Imaging's presentation, Applications and Operation of the Multimodal Animal Rotation System. Due to the number of people here today, we have muted all attendees. If you have any questions during the program, please type them into the question box to your right. Where it says Send To, choose to send questions to staff. At the end of the presentation, we'll have a short Q&A session. We'll try to answer as many questions as possible during this time, and we'll contact you directly if we are unable to answer your questions online. I am now pleased to introduce you to today's speaker, Dr. Todd Sasser, a field application scientist here at Bruker Molecular Imaging.
Thanks, Meryl. Welcome to Applications and Operation of the Multimodal Animal Rotation System, the MARS system. I'm Todd Sasser. I'm a field application scientist. So today's presentation will cover some background on the in-vivo multispectral and extreme imaging systems, and we'll also review some multimodal animal rotation system applications from various end users. And then we'll also tie in some operation training for the MARS system as well as the Bruker rotation software. So by way of background, the Bruker molecular imaging systems, the optical imaging systems include the In-Vivo Multispectral FX Pro system. This was the first multimodal optical combined X-ray, radioisotopic, fluorescence, luminescence imaging system on the market. It's a benchtop imaging system, and then more recently we have developed the In-Vivo Xtreme systems. This comes in two configurations. The front illuminated system, which is configured with a 16 megapixel camera, and the back illuminated system, which is configured with a 4 megapixel camera. There are some application and capability configurations that are common for the two systems. Again, both systems provide for fluorescence, including multispectral imaging, and that's what's shown here in the top left image, where we're able to image multiple fluorophores, even if they have closely overlapping spectrum using multispectral fluorescence imaging. Radioisotopic imaging, and that's what we're showing here in the top right image. A FDG tracer and the uptake in the heart with FDG. Luminescence, and that's what's shown in the bottom image here, and then X-ray imaging capability, obviously. And one of the primary values in addition to the multimodal imaging, anatomical and functional imaging, is the ability to neatly co-register the images. And so you can see here animals are contained in an animal sample chamber. We can control the environment in the chamber, and we can import gas anesthesia. For fluorescent illumination, it's an inverted illumination design. It's an inverted detection design. It's equipped with a 29-position excitation wheel and a 6-position emission wheel. So it allows for imaging in the low visible and into the near infrared range on both the excitation and the emission spectrums on these systems. For multispectral imaging, we utilize an excitation-based multispectral approach. We cycle between multiple excitation filters, a single emission filter, and then you can see to the right we apply a multispectral model, and we're able to separate multiple fluorophores. In this specific example, we're looking at Alexa 700 and Alexa 680. So even when fluors are only 20 nanometers apart, using multispectral imaging, we can separate out the spectrum. Reflectance imaging, on the multispectral we use a xenon lamp source, and for the extreme we have a dedicated RGB LEDs for reflectance imaging. So we can use that for anatomical imaging if we so desire. For luminescence imaging, we just leave the imaging window open, and we do a direct acquisition with no illumination. So it's dependent on the enzymatic or enzymatic reaction for the luminescence output. For radioisotopic detection, the key for our combined optical and X-ray and radioisotopic detection is our phosphorus screen. So for our radioisotopic and our radiographic detections, a phosphorus screen slides between the sample and the detector. That gamma energy strikes the phosphor is excited, relaxes, emits photons. So using this CCD optical detector, we're able to alternate seamlessly between our optical and our radio and X-ray detection. So the sample is not repositioned at any time between sequential acquisitions. Radiographic stream slides between the sample and the detector. X-rays applied overhead. Same principle, that the phosphorus stream is excited, relaxes, and then emits photons for our X-ray detections. Should be aware that some of the preclinical imaging protocols, there is intellectual property around some of these protocols, and this is some of the relevant patents. So as far as the standard imaging applications using the two-dimensional imaging capability, the systems are capable of imaging from 1 to 5 mice at a time for the 2D imaging, and this is just the typical kind of an example for X-ray imaging. This is a group that has used barium sulfate to look at phenotypes of various mice strains with particular genotypes that might be have vascular significance. So essentially they have administered or infused barium sulfate using a syringe pump into the various mice, and then you can see in the X-ray images the vascular density. In this particular example on the left, we're looking at arterial angiograms, an MMP PAR, and a diabetes model. And then in the right, we're looking at ex vivo, the same mice, and looking at a coronary angiogram. And if you were to reference the publication, you can also view angiograms for the brains, lungs, GI, kidneys, and livers of these animals. And you can see here in the right figure, they're able to actually quantify differences in the vascular density based on this barium sulfate vascular density in the X-ray. Another typical type of imaging experiment in vivo preclinical imaging is tracking and imaging cells. In this case, a group is looking at the progression for a lung tumor model. They've directly and surgically implanted A549 cells that have been transduced with luciferase, and then they've monitored the progress over multiple days, up to 65 days. And you can see here the luminescence detection at day 7, 14, etc., and then up to 64 days. And in the bottom, you can see a plot. The blue line shows us the luminescence signal in the lungs over time, and the corresponding survival plot. So you can see that as we would expect, shows quite nicely as tumor burden increases using luminescence signal as a marker for increase in tumor burden, we get a decrease in survival rate. And so we show nice inverse correlation between these two variables. Early on, we recognized the value for multiple imaging multiple angles. So you can see in this ventral view of a tumor metastases model, it's not readily apparent where exactly this tumor is located. But simply by manually repositioning the animal into a lateral view here, we can see that, in fact, there are 2 tumor sites, which isn't really apparent in the ventral view here. So we can see one at the end of the jaw and one internal in the mouse jaw. So with this in mind, we developed the Multimodal Animal Rotation System. The Animal Rotation System is compatible with the DXS Pro, which we haven't mentioned before, but is essentially the X-ray component for the multispectral imaging system, minus the optical imaging modalities. The FX Pro, which has the same capabilities of the multispectral FX Pro minus the multispectral imaging capability, the multispectral FX Pro, and the Xtreme imaging systems. The module can be quickly inserted and removed from the imaging system, and so essentially all you need to do is position the module over the imaging window when you want to use the animal rotation system, and then initialize the MARS for imaging. And the animal rotation system rotates the animal And this is all in concert with the multimodal imaging. So the phosphorus screen slides in and out under the animal rotation system, and the multimodal imaging protocols that you would normally use for multimodal imaging are all intact. So one of the initial proof of principle experiments that we performed was to look at the signal and the localization at different anatomical regions. In order to provide contrast, we injected both some X-ray and some fluorescent contrast agents, and so we administered barium sulfate and X761 nanosphere near-infrared fluorescence for gavage, and we IV injected X670 and Visopaque. Visopaque is a contrast agent for vasculature, and X670 is a near-infrared fluorophore. So if you look at the X761, you can see that we get contrast around the stomach and in the intestines, and we also see in the X-ray image only barium sulfate contrast for the GI tract. In the next image, we see kidneys and bladder. So you can see as the image rotates, we see kidney 1, kidney 2, and the bladder, and then we see the overlay in the far right panel as well. So an aspect of this imaging to highlight is that the angle of detection, the sensitivity, is changed significantly. So in addition to providing anatomical value, we also have optimized sensitivity depending on the angle of detection, as well as the ability to recall the angle. And this is a typical type of panel display for the rotation that you'll see in publications utilizing the multimodal animal rotation system. So, and then we imaged multiple mice that had received these injections, and we quantified and overlaid the signal from these samples. So what you see in the y-axis is the intensity for a particular fluorophore at an anatomical area that we've quantified. So the purple plots correspond to two different animals, and they are the right kidney of the two different animals, and you can see that they show good correspondence so that you would be able to recall a kidney from one animal and a kidney from another and be able to make valid comparisons simply by recalling a specific angle. The blue is the stomach, the yellow plots are the bladders, red is the intestines, and then the green is the left kidney. So in all, the Mars imaging offers essentially three primary benefits. That is more anatomical information, maximize sensitivity because you can optimize the detection angle to have the shortest tissue path so that there's less scatter for optical signal through the tissue before detection. And then also it provides for reproducible analysis. A couple of application examples. We showed before the angiogram applications. This study was created at Notre Dame University and the group that had published the previous results from the University of Louisville using a very similar protocol where an injection of barium sulfate is administered, and this is distributed throughout the vasculature. So we can see here essentially a lot of the vasculature, and we also get a nice appreciation for the localization for vasculature in the animal. We could always select any one of those rotation angles for particular analysis. So it provides a lot of angles, a lot of anatomy for relative comparison. This is an example for a xenograft implant for colorectal cells. The cells were pre-labeled with a near-infrared fluorophore. They were allowed to grow up for about 2 weeks, and then they were imaged in a rotation protocol here. And so what you can see here is that we have an optimized angle at about 120 degrees. So in the future, if you want to make sure that you're making inter-animal and intra-animal comparisons, valid inter and intra-animal comparisons, you can select this optimized angle for this particular animal. If you have another animal and the optimized angle is a little bit different, you can select that particular angle. You don't always need to execute a full rotation for subsequent longitudinal points. And then at top, we have here a surface plot that has a nice visual representation for the intensity for these particular values. Particularly useful, the MARS system is particularly used for metastatic tumor models for a couple of reasons. Number one, the cell density can be quite low, so the cell signal can be quite low. And number two, you don't always know where, obviously, the anatomical region of interest will be, so it surveys the full animals and allows you the maximum opportunity to identify a metastatic site. In this particular model, the group is working in an IP metastatic model. They have injected IP, GFP positive ovarian cancer cells, and they've allowed metastatic sites to develop, and they've imaged at a full 360 degrees. So GFP is not necessarily an ideal floor for in vivo imaging. The wavelength is subject to significant amount of light scatter and attenuation in tissue. So the group has also worked with near-infrared imaging as well. So in a recent publication, they labeled cells, pre-labeled cells with a near-infrared fluorophore, and they checked the viability of the cells prior to administering in this IP model here. And so they subsequently imaged mice in their metastatic model, as well as a subcutaneous model at 7, 14, and 21 days. And at top, we have the rotation display for these animals. We can see here from degrees about 120 to 180, we see clear quantitative values for the subcutaneous implant. And then in the IP, we see high density, high intensity values for the primary IP site. And then actually what this reveals is that we see some satellite tumor sites at around 20 to 40 degrees that really aren't visible at any other angle of rotation. And then, as with the previous experiment that we had showed, you can image over time and make valid comparisons for specific angles, and you can always be sure that you're not seeing differences in intensity simply because your animal is positioned a little bit different at one time point versus another. This is another display for the data, rotation display, where we see the subcutaneous implant site clearly and corresponding 3D surface shown the display here was rated in the Xtreme software, the rotational movie surface plot. Another group has utilized the rotation software for a bone imaging comparison with SPECT and PET imaging. So in this particular example, the group is using the diphosphonate near-infrared fluorophore osteosense from Preclinical to visualize different bone anatomy, and this is registered with X-ray. And they were able to show that they got excellent optical signal-to-noise ratio, target to non-target, with excellent error in their analysis. So that this was target to non-target for looking at the knee joints in animals at different rotation angles. And then again, you can see, appreciate, I think, how valuable the rotation displays can be in that you detect the functional anatomical regions that would be quick to necessarily predict. And then finally, a recent example, an infection and inflammation model where mice were injected with Staph aureus, a intramuscular injection of Staph aureus, and then used a two-modality fluorescence and luminescence. Luminol provides a substrate for myeloperoxidase activation, showing neutrophil activation, and this is shown here in the panel below. In this case, myeloperoxidase activation appears to be occurring in the bladder region in response to this infection. As a primary response to this infection, we also have a iodine contrast agent in the bladder, so that we see this localizes nicely the X-ray with the optical luminescence signal. And then, not shown at the bottom but shown at top, we've also used a bacteria-specific probe here. So the blue represents the luminol detection, and we can see clearly the bladder with the X-ray contrast. The red represents a bacterial-specific probe, zinc DPA, that binds to anionic lipids and localizes to the specific site of infection at an early time point. So the remaining few slides will review the operation for the animal rotation system. So you position first the rotator in the frame in the imaging cabinet. So this is the base of the frame. Normally you would position the Mars unit itself in second. There's a notch over the back, built into the back of the frame. You want to put this over a locator pin. This holds this frame into position. Next, we'll position the rotator into the shoulder bolts of the rotator into 4 of the slots. So you can see the bolts are in these slots. Next, you want to make sure that this set screw is on the outside of the animal management system like it's shown here. And if it's not already done, set this to the highest position. You want to make sure there's sufficient clearance for the phosphorus screen to slide under the Mars unit. Next, we'll connect a control cable. This resides within the cabinet. It should be the only cable that's not connected to anything within your cabinet. Plug this into the side port on the Mars unit. This is not shown in this particular display. We'll change the toggle to auto, and we can close the hatch on the system. At the rear of the rotator unit, there is a tube to connect your anesthesia to. You can simply connect the tube that should already be installed into your system to the nose cone tube, and you can import your anesthesia. You also have the option to import your warm air and your exhaust. This can exhaust to a scavenger to collect any excess isoflurane from the unit. There are 2 different methods for initializing on the multispectral versus the Xtreme system. If you're working with the Mars module on the In-Vivo Xtreme system, you'll have an external controller. So this is on the right-hand side of the imaging cabinet. You simply will power the system controller on at the back right of the system. And with the module plugged in, it should begin initialization once you've launched the software. With the In-Vivo Xtreme system, it's a little bit of a different initialization. There is no external controller, so we'll actually go to capture. We'll get our capture screen. If you're not already in the advanced capture screen, select advanced and then select preferences, and then you'll get a components tab, and then we'll select initialize Mars, and this will initialize our Mars. And we should see the rotator tabs rotate. Now, if you're ready to begin imaging, we can simply position our animal in the system. There are 2 software packages related to Mars imaging. The MI software, which drives our acquisition, including multispectral and Mars acquisitions. The software is also used for data analysis, so region of interest analysis, overlays, etc. And then the Bruker rotation software is used to process our rotation acquisitions, our Mars acquisitions, once they're complete. Finally, to set the parameters for our Mars acquisition, we will generate a protocol. All Mars acquisitions need to be executed as a protocol. This is so that the rotation software can process the acquisition file. We will generate multimodal steps below in the protocol. So we would, for example, program X-ray and fluorescence as normally for multimodal imaging. And then we would, once we've done that, set our rotation parameters. The default here, you can say full rotation default, and it will image at every 10 degrees. You can change the range here, and you can change the degrees, and it will tell you how many rotations in total it will use for the acquisition. So generally, you might not need to use at every 10 degrees. So if you're simply interested in an example for making sure that you're not missing any signal or looking for metastatic tumors, you might only image as many as 8 to 10 rotations. So you would change the range and increments accordingly for that purpose. So for example, you might set the range to 400 and the increments to 40. If you're interested in calibrating each animal for rotation angle, you can go to the preview. This is an optional step. Typically, if your mice are of a pretty similar size, you're not comparing very large versus very small mice in the same data set, and you have calibrated to one particular type of mouse. You should only really need to do that once for the mouse type that you're using. So to do this, you go to Preview, Load Mouse, and then just follow the instructions. If it asks you to rotate or optimize the display angle, you can do that selecting the arrows here. Once our acquisition is complete, we'll launch the rotation software. You'll navigate to your data set, and in the folder, select any of the XML files included in the data set. Below, you can select forward or backward preview, or select any one of these below, and we could visualize that particular degree that we've selected. We can turn off any modality. In this case, I've turned off the opt modality. You can see this is with the 750 X-Station 830 emission. So now we're getting only the X-ray display and a rotation in this case. Come back on, turn this on. We also optimize the display by changing the contrast. So I can change the maximum and the minimum. Any changes that I make here for that particular modality will be applied to all rotation angles. So I don't need to go through each rotation angle and readjust those, obviously. And then you can see that I have a change in the X-ray. I can also smooth the image. So I select the smooth button. It just is a little bit more visually appealing, depending on the display. We'll have the image optimized. I can either select an angle to analyze, so I select MI, open MMI, that's what that MI button stands for, and it will launch automatically in MI, and I can perform ROI analysis. Or I can select File, and I can export movie, okay, and then simply save it wherever I want. In this case, I'm saving the same folder as my animal rotation data set, or I could save it on a desktop. The type of file by default that will be created will be something like this. Okay. Additional resources, there is a couple of additional webinars pertaining to Mars imaging that are available at our YouTube Bruker Molecular Imaging website. And the first is an introduction to Mars. There's also a nice practical techniques for image optimization using the Mars with the Multispectral FX Pro, which addresses some animal preparation considerations from our end users in Cincinnati, as well as the Mars user guide in addition to that. With that, I would thank you for attending today, and if there are any questions, I'd be happy to take those now. You can also contact me directly for the time being at todd.sasser@carestream.com until we have our Bruker email addresses.